Is one of the most frequent questions that we used to get when I worked in the crisis unit, and that is where to bring somebody or where to go if you're having a mental health or substance abuse type of crisis. And what we often had to do was divert people to other places, because if you don't know where to go or what exactly it is that you need help with first, meaning if you are someone who has a child with mental health issues versus an adult with mental health issues, or someone who has mental health and substance, or you have someone who needs rehab versus detox. These are things that honestly are more of an issue to find the correct type of services than one would think. So the other thing is, obviously there's different facilities in different parts of the world. You know, there's some places that where I live in New York, there are only 2 hospitals that take children for mental health reasons. And one, they take them down to age 5. The other one doesn't take them until they're 12 years old. So knowing those little details is sometimes also very difficult for parents, obviously, because they're already dealing with whatever it is that their kids are going through. And then on top of that, they basically have to like research and call places. And that's just something that they really don't really want to have to do at that point. So to have a resource that can give you an outline in your area is super helpful. And I honestly don't know if they have them in a lot of places. So one thing I'm going to be doing is at least starting to do my immediate area. I'm going to be giving, making available printouts and videos like this that explains basically a step-by-step of how, when, where to find the appropriate services for you or your loved one. Aside from children and adolescents, I would say the other common issue is somebody who has substance abuse addiction, as well as mental health. I will say that really you may be seeing the substance abuse, but the substance abuse is going to be coming from 99% of the time some type of mental health issue. So until they have the mental health as well as the substance abuse help, they're probably not going to get the substance abuse under control. I'm not necessarily saying that the AA and a 28-day program and 12-step program is an end-all be-all for every person. I truly feel like it's an individualized care. Everyone's different. Everyone comes from different backgrounds. Everyone has different traumas. Everyone has a different type of substance that they use. So each substance is going to require a different type of care, meaning if you have someone with alcohol as their substance of choice, they will actually need to be watched more closely while they're detoxing, possibly will need to go to a detox unit, as would somebody who uses benzodiazepines, Ativan, Xanax, Klonopin, or I should say overuses them, because those are 2, and opiates would be another example, heroin, hydrocodone. The thing is that those are the drugs that you're going to actually have a chance of withdrawing from, to the point where you're going to feel sick. The difference though is that opiates, while ingesting them too much, you can obviously overdose. The withdrawal from those feels awful, but the person isn't going to be in danger of dying from that withdrawal. There may be other complications, obviously, but the withdrawal itself from the opiate drugs won't kill them. However, someone who uses alcohol, benzodiazepines, anxiety medication, etc., if they withdraw, they could actually die. So these different situations are all things that need to be taken into consideration when you're looking for exactly what type of treatment a person needs and where to go. In our current area, we have detox units separate from rehabs, separate from the mental health hospitals. So it honestly becomes like this ping pong game. We'll have somebody come into the crisis unit, which does deal both with, it's within an ER, so it does deal with withdrawal and with mental health. We evaluate everyone who comes in, but a lot of times what happens is they come in thinking that they're going to kind of get like rehab help, but that's not what that particular hospital offers. Or they go to the ER that's got the hospital with the detox unit and they're looking for mental health, and then they end up having to transfer 2 ER bills. A lot of time, sometimes people are held at one facility or the other for, days. It doesn't even necessarily mean hours, it means days. If you bring a child to be evaluated at a place that doesn't have a children's unit in case they need admission, this is either for medical or for mental health, honestly. If you don't do the research and don't know ahead of time that the child has a place to go if they need to be admitted and kept overnight, then they're going to be sitting at that wrong hospital for possibly days. We've had kids for days up to a week waiting to be transferred to another hospital. And now I want to just give a little bit of like an aside here. I'm not saying to, go to the farther hospital and put somebody at risk. I'm definitely not saying that. If you have an emergency, if you have any type of emergency where you think yourself or someone else could be harmed, or you aren't sure, what the right thing to do is, or, you live maybe for our case, for example, so in Albany, maybe you live in Albany and you don't have a way to get all the way to Schenectady where there's a kids unit. Obviously, don't just, not go. You can call 911. My suggestion is if you feel like it's serious enough where someone might get hurt, always call 911. Do not try to drive somebody to the hospital by yourself. This is for medical and mental health, because if something ever happened on the way to the hospital, it could put them in danger, you in danger, other drivers in danger. We have actually had situations where parents attempted to take their children to the hospital. Their children were not happy about it. It was mental health and they were behavioral as well, and they did not want to stay in the car. And when the car stopped at a red light, the child got out and ran. And this almost caused accidents. It caused, obviously, police involvement. So just be sure that if you have any possible even thought that something could go wrong, that your child isn't willing, or whoever, your sibling, your child, your friend, your parent is not a willing participant wanting to go to the hospital, to the doctors, whatever it is, do not get them in the car unless you can do it safely. And just a reminder for everyone, it is difficult to know sometimes whether it's a true emergency or not. So, if you truly feel like any mental health or medical thing is an emergency that can lead to, like I said, harm, then call 911, go to the hospital. This is not me saying don't go to the hospital at all.